The idea of persistent pain, SheffieldPersistentPain.com, was that we recognised that we're not very good at giving information to patients often. And we're not very good at giving information to patients in a way that they can understand it and a way that they can make sense of it. So we wanted to develop an interface that helped both GPs in their day-to-day work with patients, but also then that patients could go away and look at in their own time. So the most important thing with persistent pain, I think from a GP perspective, is making the diagnosis in the first place. The next step is then helping people to understand what that means for them. So using web resources and using information to back that up can be really helpful in helping them to understand that they're not alone. There's a lot of other people who've learnt to do this, and these are the sort of things that they've used to help them get to a more healthy and more stable place.
Some people use the computer all the time, and they use it to look up information. So there's a subset of people who would go to the computer to look for information about their health condition. But there's another group of people who they use the computer, but they wouldn't describe themselves as experienced computer users. And when you talk to them about this, they're using it for things like shopping, online shopping. That group of people needs a little more support in terms of introducing them to the website, what it looks like, how to navigate their way around it.
And then I would encourage them to look at some of these informations on their own, with other people, and come back to me and let's keep a dialogue going. The one real advantage of general practice is that we get to know patients over a long period of time. One of the things that we've learnt really as we've been doing this is that yes, people like to discuss things with family and friends, but it's also quite nice to have someone neutral who's skilled at drawing people along the journey. And that's where health trainers come in.
Rather than coming to see a healthcare professional who's basically giving people advice, health trainers use a much more coaching approach and really helping people identify goals for themselves and then work out how they might work towards that. They're not medically trained, and I think that's one of their strengths, is that they are drawn from the local community. So people, when they're coming to see a health trainer, aren't coming for another tablet or another injection type treatment. They're really coming to see someone who's going to help them manage their condition better, whether that's a chronic pain problem or whatever chronic health condition it might be.
On the first session, I would leave that time for around about 45 minutes, and within that session I'd explain what my role is, and then I would ask them about themselves, and I would try and gain rapport with that person, and I'd give them a few resources, and I would bring the website into it at the very end, just to say, well, this is available. I'd show them it so they can see the visual side of it.
We've at times found it hard to recruit patients into the project. This is new for doctors and nurses. It's also very new for patients as well. And then they're not used to necessarily being asked to use web resources as part of their usual care. They're certainly sometimes a bit reticent to answer questionnaires.
At first, I was a bit apprehensive. But I got into it and I went on to coping with pain, and it's been really helpful. It's
also been a challenge to persuade GPs and nurses and physiotherapists to incorporate this into their normal working pattern. We're already very, very busy, so to ask people to add an extra thing on to the way they usually do things, it is a challenge. And I think these are the sort of challenges that face anybody that's trying to change the way things are done.
This website we should design for the people who are hard to reach, who can kind of more benefit with this website, and we can use a very simple language, more video clips, more pictures, where they can kind of find exactly what is being said or where is the pain is, so they can see, they can visualize, and they can kind of follow the instructions from there. And
it's very much client-led. They want to hand the control of the service over to the client, and the client defines what they think they need in terms of managing their own condition, and out of that comes a need for information. And at that point, when the client is asking for information and tips, the health trainers are tending to refer them to the website. So the health trainers feel that it would be quite disconcerting if a person's coming with expectations about having a conversation and they're immediately sent off to look at some information. So they do something instead, which is called, we would call it opportunistic learning, which means you look for opportunities in the course of the sessions with the client, where the client might be looking for information and be ready to try something. And when you see those opportunities popping up, then you refer them to the website.
I shall definitely recommend it now. And I mean, it didn't cost anything to go on, so just look it up and Bob's your uncle.